Good morning, everyone. Our guest today is the Majority Whip, U.S. Senator John Cornyn of Texas, our senior senator from our state. We appreciate your time this morning, Senator Cornyn. I know it's a busy day on Capitol Hill. Every day is probably a busy day right now.
Well, this time is a little busier and a little more disorienting than most, but I'm glad to be with you. Thanks, Judy.
Well, I want to start with the very latest because right now there is a Senate committee hearing going on. Dr. Fauci and some public health experts, I'm told, will be testifying shortly. And they have some concerns about reopening the economy prematurely without the proper public health remedies in place, the testing, the contact tracing. Where do you stand on that? And what do you think needs to be in place before we can fully reopen our economy?
Well, I think public health needs to come first, but we have to also try to figure out how to emerge from this lockdown, because obviously it's having a devastating impact, not only on people who have no income, but on our economy more generally. So I think that's why it's important to listen to the public health experts, people like Dr. Fauci and Dr. Birx and others, and to give us their best advice about how we do that safely. We know that there are grocery clerks, there are nurses and doctors on the front line. There are other essential workers, so-called essential workers, who've been doing this safely using personal protective equipment and appropriate hygiene and social distancing. And I think this is something we can all and are learning to do too.
I want to talk a little bit more about testing. I just saw Senator Lamar Alexander, who opened the Senate hearing by talking about the fact that the number of tests we're doing is impressive, but not enough. So I know your office as well announced the $4 million coming to Central Texas for testing and additional money coming for testing. Are we there yet? How can we get more federal dollars to get to where some of these health experts say we need to be to feel like we can get a handle on COVID-19?
Well, I just left a meeting with Dr. Francis Collins of the National Institutes of Health, and we were talking about this. The truth is that there are a variety of different types of tests that are now coming available. Unfortunately, some of them take a while, but then there are new ones from Abbott Quick Tests where you can do it in 5 minutes. There are going to be new antibody tests, which you can take ultimately, we hope, in the privacy of your home to see if you have the antibodies. What's so confusing about this virus is you may have it and not even know it. And so right now, only people who have symptoms and who ask to be tested will be tested. At some point, we need to broaden that more widely, particularly, it seems to me, as our students go back to school, to give people the confidence that they can do so and do so safely. So we're ramping the number of tests up dramatically every day. And to me, it's as much of a confidence builder as anything else. But yes, we need more tests. We need smarter tests. We need quicker tests.
It really is a balancing act that we're witnessing right now to try to rescue the economy and to make sure people feel safe. How do you think we're doing in Texas so far? Our governor, who I know you've been in close contact with, is reopening gradually. There's always a back and forth between the state of Texas and Central Texas about what's the right thing to do on many of these situations. Our mayor and our county judge have said it's not yet time. How do you think we're doing?
Well, it's not surprising to me that there are some differences of opinion. I think everybody's trying to do the best they can and to do that reopening safely. I know I've known the governor a long time, and I talked to him a lot, just as I talked to Judge Eckert and to Mayor Adler there in Austin, where I live. And so there are some differences of opinion, and I think we're trying to strike that right balance. And I think only time will tell whether we've hit it. We may need to readapt if we have some hot spots, we have some unexpected breakouts. But as long as we can follow the guidelines from the public health officials on social distancing and the like, nobody ever expected that we'd stay locked down until we get a vaccine. That may be months off. Hope faster is better. But that's ultimately going to be the gold standard in terms of controlling this virus and protecting the most vulnerable population. that's in the same sort of category as seasonal flu, which also can be deadly if not dealt with.
One of the things that we're seeing are these holes in the safety nets. Many Americans have their health insurance, for example, tied to their jobs. And with so many people losing their jobs, there are people who are lacking health insurance. I know that you've not been a big supporter of the Affordable Care Act. Texas has not expanded Medicaid, a state decision. What do you see from the federal level as ways to help these folks who have lost their jobs and have a very small window to sign up for the Affordable Care Act and are wondering what they're going to do for health insurance?
Well, the good news is that if you lose your employer-provided coverage, which covers about 180 million Americans, then that is a significant life event, which makes you then eligible to sign up for the Affordable Care Act. And as you know, it has a sliding scale of subsidies up to 400% of poverty. So that's an option for people. We've also essentially made testing for COVID-19 free, or at least the federal government has said we will pay for it. And so we're trying to deal with this healthcare challenge, but this is a unique type of challenge. But the good news is people can get coverage under the Affordable Care Act or via Medicaid based on their income, and through free testing from public health authorities as a result of what Congress has done on a bipartisan basis.
I know during some of the hurricane disasters, the president has done some things to make healthcare affordable and to make healthcare available, extended windows and things like that. Have you seen any of that happening?
Well, we've tried to do everything we can to help our healthcare workers. They've really been the frontline heroes in this fight, and trying to make sure they have a personal protective equipment so they can treat the patients that come in. But we've told them, please don't do any elective surgeries. And so ironically, some of them had to furlough their frontline healthcare workers. But we've tried to do everything we know how to do. And if anybody's got a better idea or something additional we need to do to respond, I think on a bipartisan basis, you're going to see Congress step up. I never would have believed that we would have passed multi-trillion-dollar pieces of legislation essentially unanimously. But I think people realize this is not a time for that kind of partisan bickering and dysfunction that sometimes occurs in Washington, D.C. This is a time for us to rally as Americans. And I think so far we've been pretty successful doing that.
There has been a little of that bickering and debate over the next step, though, over whether more federal money should go to the states, which can't operate at a deficit like right. The federal government can. Where do you see that going?
Well, that's a great point. The federal government can deficit spend. At least for now, we're going to have to have a reckoning with that at some point because it's going to have to be paid. But you're right, most of the states and local governments have to operate with a balanced budget. And I've been talking to the governor, I've been talking to mayors and county judges in Texas. They are very concerned that they won't be able to provide basic services like fire and law enforcement protection unless they get some help. That's the reason why we've appropriated so far about $150 billion. The Texas share is $11.2 billion. Some of it went directly to the bigger cities and counties, and others is now being funneled through the governor's office, but hopefully will be disseminated in a way to provide some help. And we're trying to see what the impact of what we've done is, and if there's more that we need to do, I'm certainly open to that because we've got to find a way to help our local authorities provide basic services to our people.
Senator, there was something that there's a quote from you in the Washington Post this weekend that said, incumbents up for re-election will be judged on how they respond to COVID-19. So I'm wondering how you think you'll be judged, and do you wish you'd done anything differently thus far?
Well, the jury's out, Judy, and we'll find, they'll return the verdict on election day in November. But I think it's been a unique opportunity for me to connect with literally hundreds of thousands, maybe more Texans using this technology we're using today. It's almost it's almost like I've been able to talk to more people and communicate with them, listen to them, get their feedback, answer questions than I would otherwise get to do if I had to fly around the state and try to meet with 29 million Texans. So I guess that decision is going to be up to them. So far, as I said earlier, I'm proud of the work we've been able to do here on a bipartisan basis together to respond to this emergency. This is unprecedented in our lifetime, and but something I know that Texans expect me and others representing them to be part of the solution and not part of the problem. And that's what I've tried to do.
I have one final question for you, and it's an unusual one, but I know you were a journalism major as an undergraduate, and our business has come under a lot of fire in recent years. Do you still think we play an important role in our democracy? And if you could ask the president one question as a journalist, what would that be?
Wow. Well, I get to interact with the president quite a bit, so that's a hard one. But let me go to your first question first. Obviously, the answer is yes. What worries me about the way we get information these days is you don't have people necessarily practicing with the old school ethics and the standards that journalists are taught in school. And right now, it just seems like there's a race to be first. And then, unfortunately, due to social media, due to the sort of the polarizing divide of cable TV, where you can watch or listen or to whatever makes you feel good or sort of reinforces your point of view. I think that's dangerous. We need to be challenged. We need to be corrected sometimes when we are wrong or when we need more information. So as far as what you stumped me here on what I would ask the president. Again, I think he's trying to do his best. Sometimes he's undermines his own message, but I think he's trying to do his best, as we all are.
Well, Senator Cornyn, we appreciate you and our representatives of both parties who are working on our behalf on Capitol Hill every day. And I know that you're taking special safety measures to do your job like everyone else is on Capitol Hill, and we appreciate it.
Thanks, Judy. Good to be with you.
Thank you for your time today. Take care, Senator.
You too.
I think, okay. Oh, I just got muted.